want you to think just for a moment right now. Imagine being a child who, for no fault of your own, lost your family. And instead of going into a foster home with a sense of structure and possibly a room and bed of your own, you go and you go to sleep on a cot in a jail cell or a hospital bed in an emergency room. Well, unfortunately, this is happening in real time right here in North Carolina. And the state is losing foster families, and the void can't be filled fast enough. Queen City News reporter Daniel Pierce joins us live in Uptown. Daniel, I think we all feel the sense of how big this problem is. Put this into perspective for us.
Yeah, well, tonight we were getting some of the numbers showing how big of a problem this is. Here in North Carolina in the past 2.5 years, there's been a 20% drop in licensed foster families. Novant Health representatives have told me that currently they have 7 children living out of their emergency rooms. And we even got numbers from the Piedmont Triad. This is the Greensboro, High Point, Winston-Salem area where more than a dozen kids are living out of these similar situations that have Novant Health's emergency rooms. Now, what the Department of Health and Human Services tell us is that each week about 50 kids enter a living situation like this, and it is a problem that is going to take a lot of effort from the community, but even then, it's only going to be able to help with a small percentage of it. Foster families are heroes in the eyes of their kids, people unrelated, willing to swoop in and scoop up a world falling apart around them, giving hope, a home, love.
To know that I had an adult fight for me and had a permanent place to live in a forever family meant the world to me.
Michaela Reinhart lived that kind of love during her foster care journey growing up. She now works for Children's Home Society of North Carolina and is seeing that happiness robbed from foster care children across the state.
But I think the most common thing that I hear is that we'll get too attached, and that statement always hits me right in the gut, because it's like, as I've said before, think about how that child feels.
FosterCareCapacity.com shows in 2022, there were roughly 10,000 youths in foster care across the state. It's closer to 11,000 today. At the start of the pandemic, there were 7,185 licensed foster families in North Carolina. By 2022, it was below 5,500.
I would say we probably get a minimum of 5 to 10 referrals a day for children, and sometimes those are sibling groups. It's already just a hard situation being the child in foster care, but then to have a crisis where things have come down the pipeline and the amount of licensed foster parents has decreased, it's just made it even harder for these kids.
On top of this lack of application crisis, there are fewer requests to even learn about fostering.
It's hard to get into places to talk about this. It's hard to get into the churches. It's hard to get in front of the community and speak about what's actually going on, because I feel like people don't want to hear it. It's really just up to the community to come together and help these children.
What is also difficult is North Carolina ranks 39th out of 49 states whenever it comes to child welfare funding. Now, state lawmakers, there are talks to try and get more funding to help remedy this situation, but right now those are just talks. Meanwhile, Michaela says that she will come and talk to any group, organization, or even small group of people that want to learn more about how they can step in and try and help with this situation. We'll have a link with more information on our website, that is qcnews.com. Live in Uptown, Daniel Pierce, Queen City News.